Today I'm very, very sad to report 4 additional deaths linked to COVID-19 infection. One of those was in Wellington and 3 are additional deaths from the Rosewood cluster in Christchurch. This brings the total number of deaths in New Zealand to 9, 6 of which involved Rosewood residents being cared for at Burwood Hospital. So the deaths I'm updating you on today are of a man in his 90s at Burwood Hospital, a man in his 80s at Burwood, another man in his 90s at Burwood, and the 4th death was of a man in his 70s in Wellington Hospital, and that latter death was associated with overseas travel. We've previously signalled the underlying vulnerabilities of the Rosewood residents and that this group would continue to be at risk. That does not make today's news any less sad. This is the largest number of deaths we have reported on any day in New Zealand from COVID-19, and it is a sobering reminder of what is at stake here. I do want to acknowledge the families associated with these people who have passed and offer my sympathy and those I think of all New Zealanders and our support, whether husbands, partners, fathers, grandfathers, brothers, uncles, cousins or friends, wherever they fit in their wider whānau. We are thinking of them and of you. I do ask that the privacy of the families and friends associated with these deaths continues to be respected. And what I can say is that of the folk who died in Rosewood yesterday, they all had underlying conditions to some degree and were all confirmed cases of COVID-19. The man in Wellington was admitted to hospital on the 22nd of March and has been quite unwell in ICU for some time. The District Health Board and staff have been working very closely with the man and his family over the time and will continue, of course, to provide support to the family. As I've said earlier on previous briefings, the Rosewood group was transferred from a high-level psychogeriatric or dementia unit. The care they have been receiving is very consistent with the high level of care they were receiving at Rosewood and would have been provided there, and that does include end-of-life and palliative care. And just before I make some more general remarks about what we are doing and how we're working closely with the aged residential care sector, I just wanted to pass on some feedback we've had today from a family of a Rosewood resident at Burwood who could not speak highly enough of the nursing staff, quoting, "They are just amazing, doing an incredible job. The communication with us was superb. We had lots of calls, including FaceTime calls with Dad. We are so grateful." And from another of the families, "We couldn't speak more highly of the staff and care Dad received, both at Burwood and at Rosewood. They Skyped with Dad and the nurse caring for him, arranged for him to see a video the family had put together, and there were lots of phone calls." So, we know that aged residential care settings and facilities are very vulnerable. The populations there are very vulnerable if we get COVID-19 infection in those facilities. And so we have been particularly vigilant from early on in the presentation of this infection globally to work closely with aged residential care and act very quickly and preemptively. And what I would say is that we've had cases to date, or have cases, in 6 aged residential care facilities around the country, and this is out of a total of over 650 facilities nationwide. I mentioned yesterday and on the preceding day the excellent care and preparation that is in place across that sector, and the fact that we have had relatively few of our facilities affected by this virus in quite a stark contrast to many other countries, I think is testament to the work they have been doing. And again, to emphasise, we've been working with them very closely from early on in this outbreak. We early on provided advice around ensuring nobody came to their facilities who had any respiratory symptoms at all. They put in place visitor policies with no visiting policies much sooner than we went into alert level 4. So I'd just like to outline some of the other measures we're working with them on, just so people understand. Every new arrival into a aged residential care facility goes into isolation for 14 days. There are no shared meals happening in the facilities. As I said earlier on, and for some time, no visiting allowed at the moment. I've asked all our DHBs to work with each of the facilities in their region to ensure they have good policies, procedures, that they have access to PPE that they need and good supply lines, and to identify what other support those facilities may need to help ensure we keep that high level of care and of preventing COVID-19 getting into those facilities. There is a low threshold for testing of any residents who might be symptomatic, and of any new arrivals. If they have any symptoms whatsoever, a precautionary approach is taken. They are tested and they are not allowed into the facility unless they have tested negative, and also a low threshold for testing staff. And obviously staff who are sick have to stay home, and there's very careful observation of any symptoms of staff. In addition, we're doing a number of other things, and last night I was on a video conference with the head of the Aged Care Association, both the chair and the chief executive, to talk about what else we are doing and can be doing with them. There will be announcements later in the week about funding for aged residential care to help offset some of the additional costs they are incurring to both prepare and look after people who do have COVID-19 for extra security and so on. We continue to work with them on making sure we are maximising the value of testing of both residents, of incoming admissions and of staff. And I have also decided to commission a review of the rest home facilities or the aged residential care facilities where we have had cases, because in some of those instances the cases have been able to be bounded very quickly with no further transmission, and others we've seen just how tricky this virus is and that it can spread quite rapidly. So we think it's a very good point in time to undertake a review of both the facilities where we have had cases to learn about what's worked well and where we could improve, but also to look at some facilities that might be similar where they haven't had cases. And my hope is to do this in conjunction with the Aged Care Association, so we can use those learnings to inform both what the facilities are doing and also what ourselves as a ministry and the district health boards can continue to do to support them. I'll just move on now to the cases for the day. I'm just finding the right piece of paper here. So today, the total number of COVID-19 cases increases by 17. This comprises 8 new confirmed cases and 9 new probable cases. There are now 628 cases of COVID-19 infection that we can confirm have recovered, an increase of 82 on yesterday's number. And our recovered cases clearly now firmly dominate the cases overall. The new total combined number of confirmed and probable cases, therefore, today is 1,366. Today, there are 15 people in hospital, no change from yesterday. That includes 3 people in ICU, 1 each in Middlemore, Dunedin and North Shore hospitals. The person in Dunedin Hospital remains in a critical condition. 48% of cases involve contact with a confirmed case in New Zealand, including those in our clusters, while 39% have a link with overseas travel. Those that can be ascribed to community transmission is still just at 2%. Yesterday, 1,572 tests were processed, which is, again, a low number. So the rolling 7-day average is just over 3,039, and in total, 64,399 tests have been undertaken. Just to comment on that, at this morning's Select Committee hearing, the CVD Select Committee, the committee heard from Professor Brendan Murphy, who's the Chief Medical Officer in Australia. And as part of his comments, he also commented on the quite big reduction in testing that has been happening in Australia over the last few days. And like me, he ascribed this to the fact that because they've got quite wide physical distancing measures and people staying at home, there are just less respiratory viruses circulating in the community of all sorts. So it's interesting to see that Australia is seeing a similar pattern to us, and a big reduction also in testing there. So saying, I've sent a message out to all our DHBs today, and we now have 70 community-based assessment centres. And I've suggested that they have a low threshold for testing anyone with respiratory symptoms over this coming week, so that we can be sure that anyone with respiratory symptoms is not due to COVID-19. Our expectation is the cases will continue to remain low, but we want to be doubly sure, of course, that we are finding any cases that could be out there. You may well also have seen the reports that a number of DHBs are now using mobile testing as well to get out to communities who may not have direct access to those CBACs.